Namaste friends, welcome to Biology Center for True Learning. Here I request you to subscribe our YouTube channel Biology Center for more videos and press the bell icon for latest notifications and updates. In this video we are going to learn the new concept sexually transmitted infections, which is popularized as STIs. What is sexually transmitted infections? Here, infections acquired by a person during the sexual intercourse are collectively called sexually transmitted infections. This is the definition taken from the NEET textbook. Infections or diseases which are transmitted through sexual intercourse are called sexually transmitted infections. Simply, we can say that a person acquired certain infections during the coitus or during the sexual intercourse. That type of infections are called sexually transmitted infections. Are there any other names for sexually transmitted infections? Yes, there are few other names. Alternatively, we can use they are sexually transmitted diseases and also called venereal diseases and also called reproductive tract infections. These are three other alternative names we can use instead of the sexually transmitted infections. Let us know some general points about the sexually transmitted infections. More than 1 million sexually transmitted diseases acquired by people every day worldwide. This figure says us how infections are spread faster to healthy persons from the infected persons. Then more than 30 types of bacteria, viruses and parasites are responsible for transmission of these type of infections during the sexual intercourse. Here, so we don't look at all the type of bacteria or viruses or parasites responsible for different types of infections. Here our discussion is limited to only few infections. 8 of these 30 different types of pathogens are linked to the following STIs are discussed in detail. What are they? The first sexually transmitted disease or infection is gonorrhea. Second one is chlamydiasis. Third one is syphilis. Fourth one is trichomoniasis. Fifth one genital herpes. Sixth one genital warts. Seventh one hepatitis B. The eighth one HIV infections. These are 8 different types of infections caused by different pathogens during the sexual contact. Here our discussion only confined to these 8 type of discussions. Transmitted infections are spreading. Mainly they are spreading by sexual contact in 3 ways. One is by vaginal sex, another one is by anal sex, and another one is oral sex. Here the STIs also transmitted through the non-sexual means also. In that, one is by sharing the injection needles and surgical instruments which are used for treating the infected person. Another one is transfusion of blood and blood products like plasma and platelets from the infected person to the healthy person. Another one is the infection spread from the infected mother to the developing fetus. These are the 3 non-sexual means through which the infections can be easily transmitted. So let us see what are the common minor symptoms and major symptoms of sexually transmitted infections. Itching, fluid discharge, slight pain, swelling in the genital region are the minor symptoms experienced by the person in the earlier stages of the infection. There are some major symptoms also experienced by the infected persons like discharges from the vagina, discharge from the urethral region, then ulcers, formation of ulcers on the sex organs, I mean genital, and experiencing the pain in the abdominal region. These are the minor and major symptoms of sexually transmitted infections. What happens if STIs are not diagnosed and untreated in the earlier stages? It leads to the many complications. Here some of the complications are mentioned. One is Rising of inflammations in the pelvic region ultimately leads to pelvic inflammation diseases. Another one leads to abortions. I mean, removal of the developing fetus before birth. It leads to stillbirths also. Stillbirths means during the in the mother uterus itself, the developing fetus will be died. Another one, it leads to ectopic pregnancies. Here the formation of zygote and developing of the zygote takes place in the following tube only. So instead of command attached to the uterine wall of the uterus, here the implantation takes place in the other parts of the body also, like in the bottom part of the uterus, like in the cervical region. It leads to infertility. I mean, it makes the people unable to reproduce, and it leads to formation of cancer in the reproductive tract. Another important point is 70 to 80% of the females are asymptomatic. I mean, do not show any symptoms in the earlier stages. Which age group people are more vulnerable to the infections? It is very important point. The age group or people fall between the 15 to 24 years have greater chances of getting the sexually transmitted infections. Next, come to classification of sexually transmitted infections. In the first slide, so we came across 8 different infections in an order. For our better understanding and convenience, here I make a small attempt to classify them in a clear-cut manner. Here, sexually transmitted infections are majorly divided into two types. One is curable STIs, another one is incurable STIs. By looking at the names, you can easily understand what are curable and what are incurable. By giving the proper treatment in the earlier stages, some of the infections can be completely cured. But in case of a few infections, the complete cure of the infections become impossible. Let us look at the infections fall under the curable category. The first one is syphilis, second infection gonorrhea, third one chlamydiosis, fourth one is trichomoniasis. These 4 infections can be easily treated if diagnosed in the earlier stages. Next, another remaining 4 infections fall under the category incurable. What are they? First one, hepatitis B, second one, genital herpes, third one, genital warts, the fourth one is HIV infections. Now we are going to learn each and every infection in detail. Firstly, we take curable infections for our discussion. In that, the first infection is syphilis. The pathogen responsible for syphilis infection is Treponema pallidum. Treponema pallidum is a spiral-shaped, gram-negative, and highly mobile bacterium. The syphilis infection spreads through the sexual activity. When healthy person participating in sexual intercourse with the infected person, this infection is easily transmitted to that person. Here, the infected mothers also causes spreading of the syphilis infection to the developing fetus or baby at the time of birth, which leads to the congenital syphilis. Congenital syphilis is nothing but getting the infections by baby from the infected mother at the time of birth. Here, the syphilis infection has 4 stages. The first stage is primary stage, second one secondary stage, third one latent stage, the third one is tertiary stage. Here, each stage is characterized by certain symptoms. Let us see what are they. In the primary stage, a small sore which is called canker is appearing on the either genital, I mean on the sex organs, or on the mouth region. In the mouth region or on the place of sex organs, the small sores called cankers are appearing. In the secondary stage, symptoms like sore throat, loss of weight, and rashes on the skin, and pains in the joint regions, and fever, then fatigue also appearing. In case of latent stage, this stage does not characterized by any symptoms because the bacteria is keep quiet and do not affect the person. Because of that, person does not experience any symptoms. The last stage, tertiary stage. Here the crucial symptoms are appearing. One is memory loss, second one deafness, that one is paralysis, another one is neurological problems. Ultimately, these symptoms leads to the complications. So this is the picturization of the syphilis. This is the palm of the person. This is the neck region of the person. These are the sores presented on this region. Other parts of the body also have this type of sores. To treat the syphilis in the earlier stage, we use the benzathine penicillin in the dose of 2.4 million units. It gives intramuscular only. Then procaine penicillin in the dose of 6 lakh units given intramuscularly every day for 10 days in the further stages. Some patients are resistant to the penicillin. At that time they can go for alternatives, I mean like using of tetracycline or erythromycin. So they can give in the dose of 500 milligrams 4 times per day by mouth, I mean they can take them orally, or giving the doxycycline in the dose of 100 milligrams for 15 days. There is another new alternate treatment is available, that is giving the ceftriaxone in the dose of 2 grams QD, means on the prescription intramuscularly or intravenous for 10 to 14 days. This is so enough to give to the infected person to treat the syphilis. The second type of infection is gonorrhea. Here gonorrhea is also called clap. The pathogen responsible for gonorrhea is Neisseria gonorrhea. Here Neisseria gonorrhea is also one type of gram-negative diplococcus bacteria. It is also bacteria. It mainly affects the genitals, I mean sex organs, and mouth of the person and rectum of the person. This infection also spreads or transmitted through the sexual contact with the infected person. It also spreads from mother to baby as in case of syphilis. It mainly affects about 0.8% of women and 0.6% of the men. Here some symptoms are mentioned. So what are the symptoms experienced by the women and by the men, I mean female and male? What are the symptoms experienced by the woman? One is yellow or white colored thick discharge from the vagina. The fluid discharge from the vagina appears in the yellow or white color. Then bleeding from the vagina between the periods. A lot of bleeding can be seen. Then burning sensation or pain when pass the urine or during the bowel movements. Then another symptom is cramps and pain in lower abdomen region. These are the symptoms experienced by the female who infected by the gonorrhea. Then come to the symptoms experienced by the men. The yellow colored or white colored drip or discharge from the penis, which is thick. Another one is burning sensation or pain when urinating. Then they need to urinate more often. Then come to the treatment. Here to treat the gonorrhea, some kind of antibiotics are used because they work more effectively. Here two antibiotics are mentioned. One is ceftriaxone, another one is azithromycin. In case of giving the medicine in the form of injection, the ceftriaxone is given. So if the patient has to take the medicine orally, the azithromycin is given. Here, the gonorrhea is also affected the newborn babies. It is infected as they pass through birth canal. At the time of birth, the fully developed fetus reach the vagina through the birth canal. At that time, this infection will affect the person. Then here, the main affecting is part is eye. It causes high inflammation and ultimately leads to the blindness. So this is the picture from which we can see how the eyes of the newborn baby are affected. Next, this is the picturization of the medicines used. Thank you for watching this video.